My name is Bisola Adeniran. I'm one of the students of United States University. I'm here to do my abdominal assessment on my patients. And what is your name, sir?
My name is Sam.
Sam, how old are you?
I'm 19 years old.
19 years old. Do you give us consent to conduct your abdominal assessment today?
Yes.
Yes, awesome. So now that my patient has given me the consent and he has given me his birth date, he said he's 19 years old, and I'm going to pretend to wash my hand right now. Hands washed, and next thing will be to position my patient to make sure that my patient is comfortable in bed. So I have an extra pillow that I'm going to put underneath my patient's leg to make sure that my patient is comfortable during this assessment. Are you comfortable, sir?
Yes.
And I'm going to also provide privacy for my patient. And I'll be making sure that there's a pillow around his neck as well. Are you comfortable, sir?
Yes.
Okay, good. Now that I have the pillow placed and the pillow placed on his neck and underneath his leg, I will go ahead now and inspect my patient. And what I mean by inspection will be to look at the skin color, making sure that there's no discoloration. I'm going to look at the eyes. I'm going to start from his head and also go to his eyes, which I'm going to shine my pin light or flashlight to make sure that there's no yellowish discoloration. And looking at it, there's no yellowish discoloration. His sclera also looks okay. It looks normal. His sclera is moist and it is normal. Okay, so now I'm gonna move to the nose area. I'm gonna shine my light to make sure that it is pink and moist. His nasal cavity is pink and moist. Next, I'm gonna ask my patient to open his mouth so I can check his oral mucosa. Can you open your mouth for me? And I'm shining my flashlight into his mouth. Good. His mouth is pink and moist. Okay. Now I want to check around my patient ears to make sure that it looks symmetrical. Looking at the external ear, there is no discoloration and is symmetrical. So now I'm going to move to the neck area. The neck is supple and there's no discoloration around the neck as well. Okay. So now I'm gonna ask my patient to pull his chest, his top up so I can view his chest wall. The chest wall, there's no discoloration looking at it. And at this point, I'm going to check for his breathing pattern to make sure that he's breathing okay. So the chest wall is normal and there's no swelling, and the breathing pattern is normal. No discoloration. No jaundice noted, no discoloration of the skin around the chest wall. Now I'm going to move to the abdomen. The abdomen also looks normal. There's no discoloration. There's no jaundice. And this stomach looks symmetrical as well. And I'm going to come from the feet area to look at my patient. And looking at my patient also the stomach is symmetrical. And you can see that the stomach is flat. It is not protruded. And there's no contour noted. So at this point, now that I've finished inspecting my patient's abdominal and skin, I'm going to check on the lower extremity just to check for edema. Okay. So now looking at my patient's lower extremity, there is no swelling, there's no clubbing of the nails. Everything looks normal. No skin discoloration. Okay. So now that I'm done with my inspection, I'm going to go back to the abdominal area, and now I'm going to listen to the abdominal aorta. And when I'm assessing the abdominal aorta, I'm going to use my stethoscope, and then I'm going to place it right above the patient's navel. So at this point, I'm trying to listen to any bruit. And at this point, there is no bruit. All I hear during this auscultation is the whoosh sound. Okay. So now I want to auscultate my patient iliac artery, which is on the right lower quadrant. So at this point, I'm auscultating for any bruit, and there's no bruit. All I hear is a swish sound. So now I'm going to go to the left area to check for the renal artery. There's no bruit, hard. Now I'm going back to right femoral artery. I'm going to pull down. There's no bruit. All I hear is swish sound, which is normal. Now I'm going to come to the left femoral artery as well. All I hear is a whoosh sound, which is normal. I did not hear no bruit. That is normal. So that ends the auscultation assessment of the abdominal wall. So now I'm going to go to percussion. So now I'm going to start the percussion from the right lower quadrant of my patient's abdomen. And here is the right lower quadrant. And I'm just going to tap. And that sound was dull. I'm coming to the that is a tympanic sound. I'm going to the left lower quadrant now. That is tympanic. So I have to make sure it is done clockwise. So I started from the right lower, which is tympanic. I came to the upper quadrant right, which is tympanic, and come to the left, which is tympanic, and to the lower part, which is tympanic. And that is the normal findings. So if I hear a dull sound, that will be an abnormal findings. So now I'm going to I'm going to palpate. Uh, I'm going to palpate my patient's abdominal wall. So now I'm going to first do a soft palpation, and let me know if you have any pain. Do you feel any pain?
No pain.
Any pain?
No pain.
Any pain?
No pain.
Any pain?
No pain.
No pain. So that is a normal finding. My patient did not feel any pain. So now I'm going to go for a deeper palpation. So you let me know. And when I'm doing my deeper palpation, I'll be going 5 centimeter deep to palpate. And what am I looking for? I'm looking for any mass, any tenderness, any pain during the palpation, any swelling of the organs. Those will be what I'm checking for. Did you feel any pain?
No pain.
Any pain?
No pain.
Any pain?
No pain.
Any pain?
No pain.
So there is no pain, and I did not feel any mass during the deep palpation. There is no tenderness, and there's no swelling of any organ. So I am done with that. I am done with that assessment. And now I'm going to go on to the left side of my patient, which I'm going to be palpating for the spleen of my patient. Okay, so I cannot feel the spleen, and which is normal. It is okay. It is normal not to feel it. So now that I am done with that part, I'm going to go to the right side quadrant, and I'll be also palpating for the right side kidney. So I cannot really palpate the kidney, which is normal. And on the same right side, there is the liver as well on the right side, on the upper quadrant, right upper quadrant. So the liver is between the third intercostal, and I will start to measure from there and feel where I can feel the liver. So did you feel any pain?
No pain.
No pain. Okay. So the liver is about 6 centimeter in measurement. Okay. And which is normal? The normal liver is between 6 to 12 centimeter. Okay, so now that we are done with the liver, we're gonna auscultate my patient. Okay, so now I'm gonna use I just remember the Murphy sign as I was going. I'm going to do a special test, which will be the Murphy sign. So I'm going to go to the right side of my patient, and I'll ask my patient to take a deep breath. And if there's any pain, my patient will let me know. So I will ask my patient to inhale and exhale as I do the Murphy test. Can you inhale? And then we do deep palpation while we're doing that. Inhale, exhale. Any pain?
No pain.
No. Patients verbalize no pain during the Murphy test. So that means my patient is not positive of Murphy sign. Okay. So now the next thing will be to do test for appendicitis. So I'm going to have you lay down flat, okay, for that test. So you're gonna move your right knee and left knee.
Right and left knee.
Yeah, I'll put pressure on your right heel. Okay, go ahead. Did you have any pain?
No pain.
Any pain?
No pain.
Okay, patient said no pain. So now I'm gonna check for fluid wave test. And this test is to check for ascites. So that means I'm gonna push my patient on the side, and if he can feel pain on the other side, that means my patient has ascites. Can you feel any pain?
No pain.
Any pain?
No pain.
So my patient cannot feel any pain. And now that we are done with that, I'm going to also check my patient for CVA tenderness, which I'm going to ask my patient to sit up in bed, and then I will go to his back. I'll put a pressure to the right side and the left side of the kidney, and if my patient can feel a pain, that means my patient is positive for CVA tenderness, okay? Can you feel pain?
No pain.
Can you feel pain?
No pain.
So this assessment or the pressure that I just placed on my patient is actually applied on the 12th intercostal space. Okay, so you can now lie down. All right, so the next thing will be to So now my patient is breathing normal. It appears okay. It's not in distress or anything. So now I'm going to auscultate, and I'm going to let my patients know that I am done with the assessment, and this concludes my assessment on abdominal assessment. Thank you very much.